We began using the Rheonix analyzers for COVID-19 tests in May of 2020. Before we had the Rheonix, NVX, and Compass analyzers in-house, we had to send out our COVID-19 tests to a reference laboratory, and that meant that our turnaround times were 2, sometimes 3 weeks or even longer. Right now, we can process tests in same or next day. We started with 2 analyzers back in May, and we've slowly been building our inventory of analyzers. Right now we have 9, and our goal is to get up to 45. That's a big operation, but by growing that, we hope that we'll be able to continue to deliver high-quality testing to the region and be able to keep people healthy. It's been absolutely, instrumentally changing for us. We've really tried to become a center to be able to process and test for COVID-19 in our region. We want to be able to take care of our community and keep our population healthy and our employers open, our schools open. It's really important to us to be able to contribute to the community in that way. And by building up our ability to perform COVID-19 testing, we've been able to do that. Each analyzer allows us to process around 400 tests per day with our pooling process. We've been working closely with Rheonix as a partner to be able to expand the resource and the testing capacity through using pooling technology. We've internally validated pooling methods both for saliva and for upper respiratory specimens. And we pool 5 specimens per test, which has greatly allowed us to extend the resource and the testing capacity. The FDA EUA is for upper respiratory specimens. It's for nasopharyngeal, anterior nair, bronchial washings, things like that. And we have additionally validated internally for saliva. Rheonix has submitted currently EUA authorization for the saliva testing, so we're waiting for that approval from the FDA. We've done over 400,000 tests here at Cayuga Medical Center under our laboratory license since we started COVID-19 testing back in May. It's pretty phenomenal when you think that we're just a community hospital laboratory, but we would absolutely not have been able to do this without Rheonix. We actually have 3 other types of analyzers in our laboratory that are capable of performing COVID-19 testing that we use for other diseases. To this date, we've not been able to get enough reagents or any reagents for any of those analyzers to be able to perform testing. Only on October 1st were we able to get a limited supply from one of those manufacturers. If we had not had Rheonix, we would not have been able to perform hundreds of thousands of tests. It's pretty remarkable. When we started, our focus was on serving our community, but because we were able to, with Rheonix's help, build our testing supply capacity, we were able to rapidly expand how many tests could reach people. And so we've been able to offer testing across the state to nursing homes, schools, employers, basically anybody who needs testing to be able to stay open, stay healthy.